Hi everyone, this is Ryan from rpnt.ca, and today we're going to be talking about the drug morphine, which has many different brand names, some of which are Kadian, MS-Contin, and Statex. You can use the timestamps in the video description to jump ahead. Morphine belongs to the opioid agonist drug classification, which means that it binds to and activates opioid receptors found in the central nervous system, or CNS. Here, you can see that we have these empty opioid receptors throughout the CNS. Morphine would bind to these receptors, triggering the opioid effects. One of these opioid effects includes generalized central nervous system depression. CNS depression may result in sedation or decreased level of consciousness, and respiratory depression or slowed breathing. Opioids can also cause feelings of euphoria, analgesia or pain relief, decreased GI motility, changes in heart rate and blood pressure, and much more. Now, there are different types of opioid receptors that each have different effects, but we won't go too deep into that in this video. Basically, there are three main opioid receptor types, known as mu, kappa, and delta receptors, and morphine has a high affinity to the mu receptors and low affinities to the kappa and delta receptors. I placed a link in the video description to an article that covers opioid receptors more specifically. So morphine can be used for the management of moderate to severe pain as an analgesic, usually when a non-opioid analgesic is not effective. Always start with non-opioids when possible due to the risk of addiction that comes with opioids. Morphine in particular has a high potential for misuse and dependency. Off-label, morphine can be used as an antitussive to relieve coughing. The way that morphine works and its effectiveness as an antitussive is a bit controversial, but may be caused by morphine's effect on the respiratory system and its effect of sedation and analgesia. Also off-label, morphine can be used pre-operatively for sedation, can be used as an antidiarrheal by decreasing GI motility, and more. Morphine is between 6 to 10 times stronger than codeine, depending on different conversion charts, and about 5 times weaker than hydromorphone. So keep that in mind, especially when switching from one drug to another. For example, 5 milligrams of morphine would be approximately 30 to 50 milligrams of codeine, or approximately just 1 milligram of hydromorphone. In terms of side effects of morphine, CNS depression may manifest as dizziness, headache, sedation or decreased level of consciousness, confusion, hallucinations, and more. Like we mentioned, morphine may cause respiratory depression, which can be life-threatening. Constipation is a common side effect of morphine due to its effect of decreasing the GI motility. Other side effects include drug dependency, urinary retention, changes in heart rate and blood pressure, nausea, and much more. As we know, morphine causes CNS and respiratory depression, which may worsen if used in combination with other CNS depressants. This means that interactions may occur with alcohol, antidepressants like TCAs and MAOIs, antihistamines, benzodiazepines, and other CNS depressants. Avoid use of morphine in patients with GI or bowel obstruction, as morphine will further decrease GI motility. Also avoid morphine in patients with acute or severe respiratory distress, such as untreated asthma attacks, again due to the side effect of respiratory depression. Precaution should also be used in patients with head injuries or increased intracranial pressure. Make sure to monitor closely for sedation and respiratory depression in these patients. Morphine is considered a high-risk or high-alert medication. It is important to be aware of the policies and procedures regarding high-alert medications in your area. To avoid errors with administration, independent double checks are often required when preparing injectable morphine. If respiration rate is below baseline, usually less than 12 respirations per minute, hold morphine and notify the provider. Also remember to always monitor for changes in heart rate and blood pressure. If given IV, it is recommended to dilute morphine with something like normal saline or Ringer's lactate and inject slowly over 3 to 5 minutes to reduce the risk of rapid CNS depression. Increase hydration and bulk-forming foods while taking morphine to reduce the risk of constipation. As with many medications, it is very important not to discontinue opioids like morphine abruptly, but to instead gradually taper the dose according to the provider's instructions to reduce the risk of withdrawal symptoms and severe pain. In the event of opioid overdose, an opioid antagonist, such as naloxone, also known as Narcan, can be used to prevent further opioid binding to the opioid receptors. Naloxone often comes as a nasal spray or as an injection. And that's about it for the basics of morphine. If you have any questions, please let me know in the comments or visit rpnt.ca for more help.